Hi, I'm Dr. Dominic Carreira. I'm an orthopedic foot and ankle specialist. I'm coming at you from my home. Like many of us, we're spending more time at home than what we're accustomed to. And I wanted to talk to you today about ankle sprains. Ankle sprains are the most common foot and ankle injury in terms of visits to the emergency room or musculoskeletal injuries. Ankle sprains are essentially twisting injuries to the ankle, and it's typically either turning in or turning out. Oftentimes it happens in sport, stepping on somebody's foot, uneven ground, stepping on a curb, and causing a twisting injury. I'm going to talk to you a little bit about treatments and also reasons to consider seeking care, or reasons why you should go see a doctor. You can visit us at Peachtree Orthopedics to get further care. The main reason to get care is really based on two things. The first is an inability to bear weight. What that means is that you can't put weight down on your foot and ankle because it just simply hurts too much. The second reason is based on pain and where it's localized. You have two bones that are prominent or stick out quite a bit. One's on the outside part called the lateral malleolus, and one's on the inside part called the medial malleolus. If there's pain directly over the bone, meaning if you press on it and the bone itself is quite tender, where it's very prominent, that's a reason to get x-rays and see an orthopedic surgeon. Once you've established that you think you have a sprain, if it's not too swollen, that typically means it's not as bad of an injury. Then you can institute some simple treatments. The acronym RICE is helpful. RICE is rest, ice, compression, and elevation. Other things you can do are consider things like braces or a boot if it's hurting too much. The third treatment to consider is physical therapy, and especially in those cases where the symptoms just don't seem to be getting better, physical therapy may be that element that helps you as a patient to really get back to normal. And so through a patient visit, we can order that for you as well. The fourth and last treatment is non-steroidal anti-inflammatories like Aleve or Advil. If it's okay with your primary care doctors or for your other medical conditions, this anti-inflammatory can help to treat pain and decrease inflammation. At Peachtree Orthopedics, we're here for you to not only see you potentially in person, but also through telemedicine. We can go over these concepts with you, evaluate you, and treat you further. Many people are trying to avoid the emergency rooms, and that is appropriate during the COVID crisis. And please reach out to us for further care if you need it. Hope you have a good day, stay safe, and thanks for your time.